Thank you, everybody. It's a great pleasure for me to welcome today Professor Annika Frahsa from the ESPM in Bern. She studied political science, North America Studies and Anthropology in Erlangen, Nuremberg, and at McGill University in Canada. She did a doctorate in sports science, and she studied the impact of participatory research on diverse stakeholders groups in physical activity promotion. So that's her field of expertise. Her habilitation was on the capability approach as a paradigm for physical activity related health promotion, and she received her habilitation at the University of Tübingen in 2021. And since May 2021, even more in presence since September 2021. She's assistant professor at the ESPM Bern, and she's heading a new research group on community health and healthcare systems research. And her group aims at applying theory-driven social science methodology to understand and explain contextual conditions of health and to apply the knowledge gained to influence social determinants of health and policy making so that healthy choices will become the easy choice for all, particularly for communities in vulnerable situations. She's currently the principal investigator of the research components of the WHO Special Initiative on Urban Governance for Health, Equity and Well-being, and she co-leads the study by the German Ministry of Health on physical activity promotion in nursing homes. So it's a pleasure to welcome you, and I give you the floor.
Merci beaucoup pour votre invitation et je suis heureux d'être virtuellement avec vous aujourd'hui. If you allow, I switch to English as German is my main language spoken at home, and so I feel a bit more comfortable, or a lot more comfortable in English than in French. Yes, thank you very much for the invitation and to speak about how to use the capability approach, as you heard, was part of my habilitation as a bridging framework to transdisciplinary research. Thank you. So the capability approach, yes. So you probably, as a Department of Epidemiology and Public Health, you know one of the issues and one of the main challenges we have in disseminating and implementing scientific findings. It's not a very new insight. It has pretty famously formulated by Green back in 2008 when he constituted it takes 17 years to turn 14% of original research to the benefit of patient care in clinical routines, which is a pretty devastating number, I would say. And this is not what we would like to achieve with all the research and science we are doing. So the question is what to do about it, how to improve practice intake, practice uptake of scientific evidence in practice, in policy making, and across very different fields. So there are two approaches to overcome both the so-called ivory tower of science, as well as the very diverse and different societal silos in which health promotion action based on scientific evidence should or could take place. So one approach really is to improve dissemination through better knowledge translation, as it is often framed. So we need to get better in talking about our results, about our approaches, translate that, provide lay summaries, are in contact and write policy briefs. So there's a whole branch of research out there in the field that works towards better knowledge translation to improve dissemination and implementation. A different and second approach to overcome this issue in dissemination and implementation is to create a different form of knowledge, a knowledge that is both system knowledge, so that provides knowledge about the context exposed to and reacting to change, to health threats. We've all seen that in a pandemic. A kind of knowledge that is called target knowledge. So that involves negotiated, agreed upon values and goals, as well as transformation knowledge, which bridges what ought to be and what is by identifying the most adequate ways and measures to getting from what is to what ought to be out there. And one approach to do so, to create, to produce, to establish a different form of knowledge is transdisciplinary research. So it refers to integrative processes that provide both for the solution or transformation of specific societal problems, but it also feeds back into academia, into research and science, and provides new scientific stimulus there. So it starts both from science and scientific endeavors and then feeds back into both parts of it. And the idea really is for transdisciplinary research to go beyond knowledge production. It is about different forms of knowledge to be produced, but it's often described in those 5 steps of a transdisciplinary research process that involves both defining problem and producing new knowledge. This is what we are all used in science and research, assessing the knowledge as well, often called evaluation, but also then disseminating it into the realms both of science and practice, and also using that new science. So far, so good. I like the 5 steps because they seem to be pretty hands-on and manageable, but it wouldn't be a specific discipline of a research, transdisciplinary research, if we don't manage to put that into a figure that looks much more complex and takes up the different parallel and integrating approaches that are shown here. The idea of transdisciplinary research is really to enable mutual learning processes between science and society, and not just a transfer of knowledge created in research to societal actors that then should apply it and implement what has been found. So it has those both aspects. It refers to societal problems and scientific problems. So the scientific field is on the right of the screen and the societal aspects are displayed on the left part of the screen. We don't have to go through the complete figure, and I'm going to list all the references towards the very end of the talk, and you are free to use the slides if you are interested in research about transdisciplinarity, where this image and model comes from. But it really highlights how what the main aspect of transdisciplinary research is really the co-production of solution-oriented and connectable knowledge. So it's about integration. So what is really crucial for transdisciplinary research is knowledge integration. So cooperation between different disciplines, interdisciplinary research, but also societal actors such as practitioners to overcome the inner scientific cooperation between different disciplines. And this is the main aspect of transdisciplinary research, but it's also the main challenge to do so. How to do that, how to promote knowledge integration, how to actually get hands-on in research and health promotion action. There are all kinds of methods for knowledge integration, but today I would like to focus on one specific method for knowledge integration, and this is called boundary objects. Boundary objects, the name says so with the object dimension. They can be artifacts, they can be concrete objects, but they can also represent abstracts, concepts, models, and framework. They should be plastic enough to adapt to local needs and the constraints of several parties involved in the health promotion issue at stake. And they should be broad enough to have different disciplines, different levels, different sectors to buy in. So they are, to one aspect, they can be very structured, but they need to be open enough to buy in at various signs. So within boundary objects, one specific approach I would like to talk about today are bridging frameworks, conceptual frameworks that can act as the boundary objects within research in health promotion. The capability approach could act, or our idea was really to use the capability approach as such a bridging framework. So today I will not talk in too much detail about the capability approach introduced by Amartya Sen and Martha Nussbaum in developmental economics and philosophy of science, but rather focus on its quality as a bridging framework. So the capability approach in health promotion really opens the lens. We look at health promotion action and at goals of health promotion research as well. It is not only about improving people's health or health status, so all those what would be listed at the very top of the figure, the functioning achievements directed towards personal well-being, may it be physical activity, which is my research field, or has been my research field for a long time, but it could also be to quality of life and other aspects related to health. What it does, the capability approach, is really to open up about the capabilities, the opportunities people have to decide for or against certain behaviors, certain functioning. So it's about the range of options they can choose from to improve their individual well-being. So the capabilities are really central because they refer to the priorities people can set, the range of options they can choose from. The capability approach might also serve as a bridging framework for health promotion research because it hints at people's agency. And while capabilities are directed towards personal well-being, agency is the range of options people have to influence change towards commodities, towards public goods and services, which are listed on the very low on this figure, but also on change in conversion factors here listed in the middle of the figure. So it is as much about the individual conversion factors, the physical conditions of a person, their health literacy, their competences, as it is about the social conversion factors, the norms and values a society have, the rules and resources that are applied when it comes to health promotion, to physical activity promotion, and any other aspect relevant for health you could imagine, as it is about the environmental conversion factors, so really the built and the natural environment, as well as, and we've all experienced that in the past 2 years, the technological environment that influences the range of options people have to choose from to realize what they actually do and are their functional achievements. And this really broadening of the lens promise the capability approach to be able to serve as such a bridging framework. I want to give you some examples from empirical research I've been involved in the past years prior to my habilitation in Tübingen and the move to Bern. I was part of the Capital for Health Consortium. It's a research consortium on prevention and health promotion that was funded for 6 years by the Federal Ministry of Research in Germany and was an interactive knowledge to action research network for health promotion. And this research network or consortium aimed to develop capabilities for active lifestyles among different population groups and among professional groups. And it also aimed to develop structural capacities located at the organizational and system level through an interactive knowledge to action approach. Within this research consortium, there were 5 empirical sub-projects. They aimed across the life circle to promote capabilities for active lifestyles among different age groups, such as children, trainees, both in nursing and in automobile mechatronics, so among as well as men 40 years or older and senior citizens. And they aimed at very different and diverse professional groups, such as kindergarten teachers, teachers at secondary school, vocational trainers, mentors, community-based neighborhood health promotion providers, as well as medical and nursing staff in long-term care facilities for senior citizens. And of course, this going for a life cycle approach in different settings, that would also mean to have different settings at hand to sustainably implement those interventions into routine services. So just one table as an overview about the settings. The groups addressed the different approaches taken for interactive knowledge to action, so transdisciplinary work, the changes to be achieved at structural level, and the interventions that were implemented to address different population groups. You can see a plethora of approaches, a plethora of settings, and really diverse groups. And the backgrounds of the different projects were in pedagogics, educational research, rehab science, nursing science, sports pedagogy, and sports medicine as well. So we only on the science part of the research network, we had a broad range of disciplines involved, and then with the different age groups addressed and the different settings, of course, we had a very diverse setup of people and organizations to be involved in the projects as well. And everyone came with a specific discipline, specific approaches, concepts, and methods to the table. So this is why we added 2 cross-cutting projects to Capital for Health that aim to develop concepts and methods, and as well evaluate the development of capabilities across the different projects, and by doing so to contribute to health promotion research in the field of theory building, methodological enhancement, and evaluation as well. And from the very beginning of the setup of the research consortium, we used the capability approach as a bridging framework. We work together with the different scientific disciplines to locate themselves within this approach. They came from concepts such as physical activity related health literacy, from social capital, as well as from socio-ecological models on physical activity promotion. And we aim to integrate the different discipline-specific approaches into one overarching framework. And this was the first step. What were concrete methods we used? How to make use of the capability approach as a bridging framework, and how does that look like? What are concrete interventions? What are concrete methods to do so? So increasing capabilities for an active lifestyle means that we worked in the different sub-projects. One approach we used there, one method to foster transdisciplinarity, one method to integrate or use the capability approach as a bridging framework was a cooperative planning approach. It is one approach established in sports science and applied to different health promotion areas that comes from community-based participatory research and brings the different perspectives to the table. So I used the example of the sub-project on improving training and increasing the capabilities of trainees for an active lifestyle. And for this, we had the trainees on the table, so representatives of the trainees. We also had teachers and trainers on the table, as well as union representatives. And from the executive level or management level, we had the director in-house of the training facility, the head of the training school, and the head of nursing training at school, as well as the researchers who facilitated this cooperative planning and approach and brought in their scientific expertise. And the overall goal was to develop actions and interventions for trainees and for the setting of nursing staff training and mechatronic training that increases their capabilities for an active lifestyle. And it starts with a very open brainstorming, goes through goal and priority setting, and then to the concrete catalogue of action. And what the capability approach did, and we brought it into the cooperative planning really at project level, is to reorientate everyone all the time and have them reflect about what does it mean to increase capabilities. It is not about implementing more physical activity offers only. So providing a slot for getting physically active, for achieving this functioning of physical activity, but rather to adjust the conversion factors, to adjust the built environment, to make it more movable, to increase physical activity at work as one of the domains of health enhancing physical activity, but also reorient education and training by installing physical education back into the training schedule, and not only content of relevant for nurses or mechatronics, but really to have that installed into the curriculum for training as well, and to look at how to open up resources at the different facilities, at the organizational procedures to really increase the options to get physically active. What this group also did is that they got involved in the process and outcome evaluation to define indicators, what would mean success for those specific settings, how would they measure success over time and changes over time. The second method that I would like to present is at a more meta level. So from the cross-cutting project Capcom, we also did interventions both with the researchers and the practitioners and decision makers involved in the research network. So we did biannual, twice a year reflexive meetings, which each sub-project where we discussed with them about the types of interventions planned, the option and barriers faced during the implementation, and the potential adjustments needed. We conducted biannual, so twice a year, thematic workshops on the different contexts. So what could health literacy add to the table? What could network analysis as one of the methods used in the project add? And we also did bilateral consultations on a weekly basis, which each project about how to improve communication within the project, across the project, and how to ensure the transdisciplinarity of the research project. So how to keep the people in the setting on board, how to respond to needs and demands expressed by the different projects. And the fourth element really is training on specific aspects, such as how to measure increase in capabilities over time. The third intervention or method we used to make use of the capability approach as a bridging framework is the Transdisciplinary Steering Committee, which was really the heart of the transdisciplinary work in this research consortium. Within the Transdisciplinary Steering Committee, that in the first funding phase, so in the first 3 years of the project, met every fourth month, so 3 times a year. And within the Transdisciplinary Steering Committee, we had multiple perspectives represented. So all the PIs were represented, representatives of the postdocs and PhDs, as well as policymakers and professionals from the different sub-projects. While the population groups addressed were present in the cooperative planning format at project level, we didn't have them represented at the steering committee, but made sure to install feedback sessions with them so that their topics would be on the table in the Transdisciplinary Steering Committee as well. In the second funding phase, they met twice a year. Within the Transdisciplinary Steering Committee, we used a case consultancy approach to really make learning across projects and across settings possible. And the committee provided kind of formative evaluation and a constant expert review. So how did the case study consultation look like? So we did the reflexive meetings with the sub-project. We did semi-structured interviews and on a regular basis with the different teams. And from that, we tried from project-specific challenges to identify 5 to 6 generic challenges that all were faced across all the different sub-projects. And in each of the meetings, we did a case study consultation on 1 or 2 cases from a specific sub-project. So the idea was that the participants or the committee members would provide their experience, their expertise, but we would also invite external expertise specific to the case studies. The idea was then really to have specific solutions that would help the case to improve or overcome the obstacles they faced, but also to provide second-order implications and transfer across the different sub-projects. So issues we had were really involvement of policymakers or decision makers was one of the aspects, communication and interaction with the different population groups, but also resources is always an issue. So how to ensure sustainable resources beyond the research project. What is the impact of the capability approach? What difference can it make? Does it make any difference? So what we found in different analysis over time was that the capability approach as a bridging framework helped to guide and synthesize research across discipline. It guided work towards transformation in the Transdisciplinary Steering Committee, and it guided methodological development in this research network. So one example from one of the papers we published from this research project is it really helped to highlight what was addressed by the different sub-projects, but also to show which elements of the capability approach were neglected in the different sub-projects. So as you would expect from a project that works or a network that works towards improving or increasing active lifestyle, achieved functionings were widely addressed. So it was operationalized as increased physical activity levels among selected population groups, so among kindergarten children, children at childcare centers. It was also operationalized as increased physical activity levels among staff, so broaden this perspective there. And the second element of the capability approach that was widely addressed within the different sub-projects were the conversion factors. So both individual level conversion factors, but also social and environmental conversion factors were addressed in the different sub-projects. So one really strong focus of the project was on staffs and professionals' competence in promoting active lifestyle. So that really relates also to the agency element of the capability approach. It's not necessarily to improve their own personal well-being, but rather to act towards change. At the individual level, more related towards achieved functioning when it comes to capabilities are the population groups physical activity related health competence, which has a cognitive component, a motoric component, as well as a motivational component. And awareness towards physical activity was the third factor at individual level that was widely addressed. At the social conversion factors, we spoke a lot about social norms and rules and resources that were adapted in the different sub-projects. So certification, quality improvement, curriculum implementation were issues, or modification of curricula, as well as changes when it came to mission statements and guidelines. At the environmental level, it was the social environment on the one hand, so physical activity friendliness of daycare center was an issue, and also how physical education is set up in high schools or secondary schools, but also environmental in the sense of access to and offer of sustainable and adequate physical activity offers. These were the things. What you notice if we go back to really the capability approach is that the concrete idea of the range of options people might have, the agency they have, this was not very present in the different projects, as were the commodities. To a certain degree, we could locate the physical activity offers into the commodities, but this was really rather underrepresented compared to the other factors. The capability approach also guided work towards transformation. In the steering committee, I brought some pictures, and I'm sorry that they are in German, but the group worked in German from the different meetings. What they did in the steering committee was really, they discussed sources of motivation. So who is really the group to be addressed? Who is the client or the beneficiary of the interventions? Whose interest should be put first or dominate our planning? The discussion were then, of course, related to sources of power. So who is going to be the decision maker? Is it the trainees? Is it the students or pupils at school? Is it the teachers, and how do they interact with each other? Sources of knowledge were also discussed and addressed within this transdisciplinary steering committee. So who are the experts within the committee? Who can bring what to the table? Is it about scientific evidence? Is it about clinical or practice evidence? And what about people as experts of their own life worlds, whom to consider and what to consider in our research? And also the discussions went around the sources of legitimation. So who's in right to decide about which of the planned interventions and methods gets actually implemented, and who has the legitimization for doing so. And where could other legitimacy lie and how to address that? What we did and used the capability approach for was also to guide methodological development in health promotion research. So I brought you some of the examples of publications from the research network that really addresses conceptual refinements. So how to link the physical activity related health competence to health literacy literature, to socio-ecological models in health promotion. It is also about methods, so how to improve and create co-creation in health promotion, what methods are applicable in which context and settings, and what are options and barriers to install co-creation there. And one of the things that the research network is still going on is how to measure capabilities, and then how to use those measurements to conduct an health economic evaluation of such a project as well. So in a nutshell, yes, we would say boundary objects, and within boundary objects, bridging frameworks such as the capability approach can work. The capability approach is a very promising bridging framework because it provides interpretative flexibility. It provides an organizational structure to have different disciplines and different sectors locate themselves into. And it has the dynamic, and Star formulated it so nicely that I put it on this slide in exactly her words, between ill-structured and more tailored uses of the objective. So sometimes everyone just wants to buy in and locate everything within the framework, whereas in other parts of the project, you would take only the conversion factors to work with them and focus on them. I will close with some, you heard about the advantages, but also to close with the challenges that might be linked to applying and using the capability approach as such a bridging framework. So on the plus side, it really helps to reorient interventions towards more upstream health promotion, which we tend to neglect when it comes to intervention research, every once in a while at least. And it helps to contextualize the processes and outcomes in intervention research. So it's not pure behavior change, but really in the sense, it is about achieved functionings. It's about what people choose to do and be, and that provides a freedom sui generis, just to have the option to choose rather than realizing a concrete functioning or behavior. It also helps to look at effect levels. If we have this reorientation and the freedom and the opportunities, it might explain no effects or very minor effects at the level of health status or concrete physical activity behavior within a short time frame of an intervention. And it helps to reorient who are the actually groups addressed in such a research consortium. Of course, there are also challenges. One challenge really is linking transdisciplinary research, linking a bridging framework to disciplinary progress. So researchers in particular tend to continuously use discipline-specific concepts rather than opening up towards more transdisciplinary approaches to do so. We have conflicting reference systems and objectives, and the issue of contextuality versus generalization is an issue. There is still a need for appropriate tools and measurement that can actually grasp change in the range of opportunities to choose from, and to turn that into measurements that could be used, for example, not only, but for example, also for health economic evaluations of intervention. As promised, I brought you some references that I referred to in the presentations, and now I am more than happy to answer any questions you have, any comments you have. Thank you very much.
Thank you very much, Professor Frahsa, for this excellent presentation, very clear and very novel for me, at least. I am not expert in health promotion, so it's very interesting to see all the concepts behind, and also the the power of transdisciplinary approaches. So the floor is open to questions. I will let the people who wish to ask a question just to turn on their camera and their microphone. On my side, while waiting for people to have a question, I have a question regarding financing. How do you deal with financing such approaches? Is this via research-based funding or?
Yes, so this was actually, it was very novel for the German funding scheme for prevention research and health promotion research. So there had been a prevention research program ongoing since 2004, 2005 in Germany with different phases. And this funding scheme funded specific projects. So they had called for projects that either did with different groups, different themes. And this call was within the funding scheme was the first one that aimed at funding research consortia and providing funding for 2 times 3 years rather than the usual 3 times projects got funded in Germany. So that was really a reaction of the funding agencies to overcome those field of research projects in health promotion, and to provide funding both for research but also for efforts towards sustainable implementation of any project within the research consortia.
And at the end of the project, are some of the the interventions that have been put in place, will these be sustainable, or do you know that they are sustainable?
Yeah, so the overall funding ended almost a year ago, so in March 2021, and it depends. Of the 5 sub-projects you saw, the ones in the training setting, so in the nursing school, as well as the training of mechatronics, they are actually sustainable implemented. So they installed quality cycle as part of the worksite health promotion management processes to continue working on providing office, integrating physical activity or physical education into the curriculum, and also to scaling up from the 2 sites we had in this project in the very beginning to more sites in Bavaria. So the whole research consortia was located in a specific part in the south eastern part of Germany, and to scale up the project in nursing staff training across Bavaria, and the same for the mechatronics. In the long-term care facilities, they actually stepped out after the first funding phase. I think it would be different under COVID restrictions now, because the need for physical activity also in long-term care facilities has become more prominent on the agenda, the need for activity and mobility, but they stepped out mainly because they were very challenged by the participatory approach and have everyone on the table, and make both staff, residents, representatives of residents be decision maker in the process. They had a very strong hierarchy in the long-term care facilities, and they just stepped out because they refused the participatory approach. So it really depended on the setting.
Okay, very, very interesting what you just mentioned. And are there questions among the people who listen to you? Leona Roth. Oh, thank you for the interesting presentation. So I guess people need time to digest, those who maybe are not so familiar with the concept, but I've seen that many of our young physician in training attended, so it's good. So I don't see any question coming up. It was really very, very interesting. You know, this field of interdisciplinary work and research is really very important in many aspects, not only in health promotions, but also in healthcare. But also we have the challenge of how do we finance health promotion activity within, for instance, ambulatory care. So we don't have currently a system that is well adapted to such challenges. I personally strongly believe that there is a huge potential for improving the health status of people with chronic diseases by more physical activity, better diet, you know, and those classical health promotion actions and activities that are likely underused at the time being. And I think there is a strong focus. One of the specificities of our institution is to combine academic public health with ambulatory care. So we do deliver in some of our departments primary care, and also have prevention activities and health promotion activities on the field. So there is really a multiple and highly interdisciplinary work that is being done, both in the field of research and in the field of healthcare and health promotion. So I think we can close now for today. And thanks again. I think there is certainly some opportunities for further interactions, and maybe when the sanitary situation will be better, we could invite you to come to Lausanne and meet some of our health promotion team in one of the other departments, and also discussing some opportunities for collaboration.
Thank you very much for having me, and have a good day.
Thank you very much again. Bye-bye.
Bye.